Welcome to the Tampa General Hospital Liver Transplant Program. Today we are going to review pre-liver transplant information. Each patient will be assigned a transplant coordinator. The role of the transplant coordinator will include patient education and support, evaluate new patients, coordinate patient medical testing, add patient to the wait list, follow up with patients from listing to transplant, on call for medical issues, and ongoing education. The liver is a large organ located under the ribs on your right side. It processes food into nutrients, stores sugar and some vitamins, makes the proteins that help clot blood, and detoxifies poisons such as alcohol, drugs, and ammonia. Symptoms of liver disease include ascites, fluid building up in the abdomen can extend to the chest, and swelling in the legs, fatigue, recurrence of vomiting blood, passing blood in the stools, itching, wasting of the muscles, encephalopathy, mental status changes, recurrent infection in the abdomen. There are many reasons why a patient needs a transplant. Part of your evaluation will be to determine your diagnosis so that we can treat you effectively. There are different options for people with liver failure. Liver transplant to include deceased donor liver transplant or living donor liver transplant, alternative medical therapies to treat the medical condition if transplant is not recommended. If you don't agree with our recommendations, you have the option to seek a second opinion from another transplant center. The evaluation will include a medical history obtained from your medical records, consults with hepatologist, surgeon, social worker, psychologist, dietitian, financial counselor, pharmacist, and others as needed, i.e. nephrology and cardiology. The evaluation tests are done to confirm that transplant is the best option and will not harm you. They include heart and lung testing, imaging, and cancer screening. Once your evaluation is complete, your case will be presented to the Medical Review Board. The multidisciplinary team reviews the case and evaluation testing, determines if the candidate is acceptable for listing, needs more testing, or is not a candidate. The patient will be notified by their liver coordinator of the decision. If approved, you will be placed on the National Transplant List. Livers are allocated by UNOS. Your MELD score determines your place on the list. MELD score is a measurement of severity of illness. It includes bilirubin, PTINR, creatinine, albumin, sodium, with exception for certain disease process. Lab frequency will be determined by how high your MELD score is. Matching for liver transplant depends on two factors, blood type and body size. UNOS is the United Network for Organ Sharing. It is contracted by federal government to oversee transplants in the U.S. UNOS manages lists, credentials centers, establishes policies, conducts education. If you need assistance, you can call 1-888-894-6361 or www.unos.org. While you're waiting for the call, be sure to notify your coordinator of any changes in your medical condition, insurance information, your contact information. You will need to provide 2 to 3 phone numbers, go away on vacation. You must be available 24 hours, 7 days a week. If we are unable to reach you at the time of your transplant offer, we will move on to the next recipient. Also notify us on updates with new medications, updates on your social support, continue to follow up with your PCP for continued health maintenance, and if you are hospitalized at another facility, please notify us. Let's talk about transplant. The call can come at any time. We will ask you some basic questions. Let us know how long it will take you to get to Tampa General. The transplant may be canceled at any time prior to starting. If it is canceled, you will be sent home and remain on the waiting list according to your MELD score. About the donor. All donors undergo careful screening to determine if organs are acceptable for donation. Even with this process, there may be risk factors not identified. Some donors have a higher risk of disease transmission than others. They are called CDC, PHS, high-risk donors. People who have been in jail, used IV drugs, have amateur tattoos, and have unsafe sex practice are some examples. We will only use CDC high-risk donors if your clinical condition would favor you receiving a high-risk organ, in which case the team will discuss this with you. We will ask you to sign a consent regarding high-risk donors. Hepatitis C donors. 10 to 20% of potential donors have been exposed to hepatitis C and can have active Hep C virus in the blood, no active Hep C in the blood as the virus is no longer there. Organs are expected to work as well as organs from a non-hepatitis C donor. Treatment is available that is effective after transplant with a cure rate higher than 98%. Accepting a liver with Hep C will require treatment. Accepting a Hep C donor may decrease your wait time. You will be given an opportunity to decide if you are interested in accepting a Hep C donor and will need to consent. Hepatitis B donors. A donor that has been exposed to hepatitis B requires patients to take one additional medication to prevent active hepatitis B. Increases the donor pool. Surgical procedure. Diseased liver and gallbladder is removed. New liver is implanted in the same location of the diseased liver. The operation is complex and takes about 5 to 8 hours. Patients may require blood products. There is a risk of complications related to surgery. All patients undergoing anesthesia have risks that include stroke, heart attack, death. Any type of surgical procedure includes the risk of infection, blood clots, and pneumonia. Surgical risks specific to liver transplant are bleeding. Many blood vessels are involved. Some patients have to return to the operating room. Bile duct leaks. Additional procedures or surgery may be needed. Primary graft non-function. The transplanted liver fails to function. Thrombosis. A blood clot may form in the portal vein or hepatic artery. Some complications may require a second emergency transplant or repeat surgery. Other complications are hepatitis C. If you have hepatitis C, transplantation will not cure the disease and you will need treatment. Rejection. You must take medications for the rest of your life. Infection. The anti-rejection medications weaken your immune system, making infection more common. Increased risk of cancer occurs because of your weakened immune system. What to expect after surgery. You will be taken to the ICU. You will be on a ventilator until you can breathe on your own. You will have many tubes and IVs right after surgery. Your family will be able to visit you in the ICU. You will be in the ICU until you are well enough to go to the floor. A surgeon will see you daily, and additional transplant team members will see you in the hospital. Medications. You will take anti-rejection medications for the rest of your life. These are also called immunosuppressants, as they weaken your immune system. Anti-rejection medications. These medications have side effects that include high blood sugars. About 80% of our patients will require insulin injections for at least a few weeks. If you are already a diabetic, you may require adjustments in your regular insulin dose. Osteoporosis, weaker bones, confusion, increased incidences of cancer, return of the hepatitis C virus if you already have this disease, kidney damage, weight gain, tremors, headaches, high blood pressure, and CBC abnormalities with electrolyte imbalances. Additional medications. You will also need to take medications that will prevent you from common infections that may occur in patients with weakened immune systems. These medications include antivirals, antifungals, and antibacterials. Post-transplant follow-up. You may need to stay locally for up to 4 weeks after transplant, especially if you live more than 2 hours away. We have a transplant house available, but it is first come, first served. You will need lab and clinic appointments up to 2 times a week for at least 2 weeks. These appointments will be in the transplant clinic at 409 Bayshore Boulevard. Appointments will decrease in frequency as your condition allows. There is a support group available to discuss pre- and post-transplant concerns. No alcohol both while waiting for transplant and after transplant. Let us know if you need help with addiction. We have resources available. Remember, call us with any issues at 813-844-7137. Send MyChart messages as needed. Remember, we are here for you.